Thank you, Oz. Thank you for having me. I'll start pretty quickly. In terms of disclosures, so none of what I'm going to show here directly relates to my funding sources, which are research-wise in clinical studies, Olympus Corporation, and on my other hat at the Toyota Research Institute on autonomous driving. In terms of what is computer vision. So computer vision is a subfield of AI that this allows us to have computers describe the world that we see in one or more images and to reconstruct properties of that world. In our case, we're strongly interested in video, in a sequence of images, and that field relates to other fields in AI, such as computer graphics, where you actually generate images, robotics, where you take the properties you inferred and make decisions and move machines, and machine learning and AI in general. In terms of recent high-impact results that we've seen, obviously self-driving cars have made a lot of headlines. We take sensor inputs from cameras and LiDAR and whatnot, and we can actually decide how should we move the car, how to interact with other road agents. We've seen a lot in medicine in general, different imaging modalities and different applications and tasks in medicine. And finally, there's a lot of impact through sort of more day-to-day computer vision tasks in terms of recognizing faces and in terms of being able to make sequential decision-making, such as even the results on Atari games or beating humans at Go. All of these are basically heavily influenced by computer vision. Of course, we've seen the whole discussion of deep fakes and how does that affect whether or not we trust what we see in the media and so forth. These are a few applications. What I'm going to talk about is mostly about tasks. Basically, what is the kind of thing that we wanted the machine to do in this case with the image? And this is important to notice when you look at computer vision results, because this is something that you can later take and translate to the clinical problems that you're interested in. So I'll go briefly over computer vision tasks. When people hear computer vision, they often think about image classification, image in, and a categorical answer out, such as, is this an inpatient image? Is there a bipolar grasper in this image? Usually people often think on the day-to-day examples, such as, is there a dog, is there a cat, and so forth. So on the right, you can see a few of these examples, and on the left, you can actually see an example neural network that basically started the sort of the latest wave of deep learning results by saying we can actually just use a deep learning network and get pretty good result on a broad ImageNet kind of classification benchmark. And the fact that it's so commoditized, the fact that you can just take a neural network and labels and go and train, that's what's giving it a big impact on other fields as well. Next kind of thing that you can do with computer vision is to infer geometry. So questions such as, what is the 3D location of things? Where is the camera with respect to the scene or the patient? The distances of objects, their sizes, and so forth. These are things that we often want to measure and use for higher level reasoning in surgery. Next we have, and related, is detection and tracking. So object detection is the part where we look at an image and we want to detect the location and is there such an object in the image? Where is there a bipolar grasper in this image? Tracking takes its notch further and basically locates a specific object throughout the video, which allows you to start reasoning about trajectories and motions and things that lead to, like people mentioned, performance analysis and so forth. More recent and more sort of related to the deep learning revolution is our ability to do semantic and instance segmentation. Semantic segmentation is the task of looking at an image and for every point or pixel in the image, ask which semantic class it belongs to. So it can be, is this pixel related to a person, or is this pixel part of a liver tissue? Instance segmentation is a slightly refined version of that, where you actually care about individual objects. So not just this is a tool, but specifically this is one tool and the other region is another tool, or similarly lesions in an image and so forth. And these use a mixture of appearance and shape cues to understand what are things in the image. And this is important to note because when you're looking at an image, you want to ask yourself, okay, how can I do this task, and does the computer have enough information to do that? These were all very much localized around a few frames, but our end goal is to be able to understand the whole surgery, and that requires temporal analysis. So traditionally in computer vision, people have done activity recognition, action recognition, and so forth. This also exists a lot in surgery, and people have looked at task recognition, action recognition, surgical phases, workflow analysis, and basically try to understand from, as the computer sees the frames over time from the video, different factors that you can tell about the surgery as it's occurring, such as phases, such as actions and tasks, and so forth. But we can take this to a larger context and ask, what's the bigger picture? Eventually, when a surgeon looks at a video, they have their own web of knowledge, their own knowledge graph, and they're trying to understand for all of the different things that they know about surgery, what's the state of these in the surgery that they're currently seeing. That relates to the point that Dieter mentioned about explainability. We want algorithms that can actually understand all of these different things and grow these algorithms when we have more data and we can annotate more examples and we care about more and more complex scenarios. So can we build an extensible AI framework that slowly grows in terms of the breadth of what it's capturing? And we've done some initial work in that direction in a recent archive in basically inferring a whole knowledge graph about a surgery as we see the surgery and slowly growing that graph as we have more data. This was all about past information, this was analysis, but we can also do prediction. People have done a lot of prediction tasks in computer vision, so you look at images or other signals and you want to forecast what's the future going to look like. They've done that in terms of video frame predictions, trajectory predictions of human behavior. In this case, it becomes very important to reason about uncertainty because inherently human behavior is uncertain and you don't have all of the context. It's important to keep note of that. Finally, you want to start asking what is the exact structure of human behavior and which phenomena am I trying to mimic? And that goes back to the question of what's the downstream impact and what is the downstream task that we're trying to achieve with this kind of algorithm. So, and that also relates to some recent work that we're presenting in this ICRA, where we're really taking a general workflow labels sort of definition, and instead of analyzing, we're actually predicting over the next 15 seconds what are the possible next phases, when is the transition going to happen. And this is, again, is a pretty extensible framework where you can have additional patient factors and you can still do the rollouts and predict what's going on. So these are all different machine learning tasks, but it's also important to understand what is the context and what do I expect computer vision to do when it comes to minimally invasive surgeries. And there are a few differences from standard computer vision. First of all, there's a lot of deformable geometry and specular surfaces because of soft tissues and bodily fluids. But the other thing is that we have a very specific field of view. That field of view is partial. It requires us to reason about the whole surgery and have a state and understand what already transpired. But on the other hand, this is what the surgeon sees when they take actions. So the information, in a sense, is there. And finally, another difference is, of course, the taxonomies, and Dr. Eckhoff is going to talk about it later. But basically, in surgery, we have our own set of labels and different semantic entities, and it's important to reason about what can we label and what do we need to label in order to get good results from a computer vision algorithm. I'm going to mention briefly that, yes, we did not focus here about beyond the laparoscopic view. There's obviously a lot to say about the OR, like Dr. Grancherov has mentioned. And in that sense, these are closer to natural or in the wild day-to-day computer vision. But obviously, there are many challenges there. Finally, just to mention in terms of getting into this field, there are two key differences in terms of the literature. One is, so this is a list of relevant computer vision, robotics, and ML venues that are all relevant. And some of them will have either medical examples or algorithms that are relevant for medical. Another thing to notice is conferences and even archive papers play a much heavier role in computer vision. Basically, by the time a new neural network algorithm gets to CVPR, a computer vision conference, it already has been for a few months as an archive in many cases and may have acquired quite a bit of citations. Doesn't mean that it's peer-reviewed. CVPR, however, all of these conferences are peer-reviewed, and a lot of the algorithms are basically published there and not necessarily even in the journals. Finally, you want to ask yourself, what do I need to ask about computer vision literature? And this has been discussed in the previous slides. We want to ask, what is the premise? What is the context? Is it rigorously tested? What aspects of the testing that was done there would actually apply to the clinical problems I'm interested in? And what was the original premise in the approach that they took, and why does it make sense for me? Finally, when we look at how to interact with computer vision, you want to be minded of what's possible, and this is why I focused on the tasks, as you're looking at different scenarios and clinical problems. Data sets are priceless. I cannot stress this enough. It relates both to achieving results, to coming up with new problems to tackle, and also starting to get a better sense of whether this algorithm will work when it's actually deployed, like Dr. Grancherov mentioned. And finally, you want to reason about which taxonomies are of interest and think about what is the right level of uncertainty in these taxonomies. And of course, there are many computer vision scientists that are looking for new problems to solve, and they'll be happy to engage and collaborate. I'm gonna, in my slides are also the references. I'll be happy to take any questions, and thank you.